Kia ora. Too many New Zealand women are diagnosed with breast cancer. Through awareness, education and research, the New Zealand Breast Cancer Foundation is helping more women to survive. That means finding breast cancer early, when it's easier to treat, and developing better treatments. Now today we're going to cover 3 topics aimed at keeping you safe. The importance of knowing your breasts and what's normal for you, when you should start having mammograms, and how you can reduce your risk of breast cancer through lifestyle choices. Breast cancer is the most common cancer in New Zealand women. In fact, 7 of us are diagnosed every day. And in most cases, there's no close family history of the disease. So when you think of it like that, in fact, every woman is at risk of breast cancer, particularly women over 50. But thanks to advances in early detection and treatment, more women are surviving breast cancer. The New Zealand Breast Cancer Foundation urges you to be breast aware from 20. Know what to look for and get any changes checked out.
Because I didn't even think about the possibilities of having breast cancer as a young woman in my 20s, I had no idea about alcohol consumption leading to hormonal spikes. I had no idea how to check my breasts. I knew that you did something here, but I was too busy having a good time. So imagine how very, very surprised I was when I was diagnosed at the age of 31, just after my 31st birthday.
The earlier breast cancer is found, the easier it is to treat.
I was 43 at diagnosis. I went to see my GP, and she did a physical examination on my breast. She picked up that there was a hardness around my right nipple, which, to be honest, I could not feel. To me, it did not feel any different from what the rest of my breast felt like.
Thankfully, most breast changes are not cancerous. But around 650 of our women still die from breast cancer every year. And men, you're not off the hook. You can get breast cancer too, although, of course, the risk is much lower. Being breast aware means knowing how your breasts normally look and feel. You're looking for any visual changes or anything that may feel different. The main thing is to know your breasts and to show any unusual changes to your doctor. While most women know about lumps, there are other lesser-known signs of breast cancer that we all need to look out for. The following graphic images were taken of women who wanted to share their non-lump symptoms. Now, if you experience any of these, show your doctor. A change to the appearance of your nipple, such as a newly turned in or retracted one. Any discharge from your nipple, including blood. Crustiness around the nipple that may be flaky, ulcerated or itchy, or even feel like it's burning.
The nipple had inverted. The ooze, there was an ooze coming out and it was green. It was a green, it changed from a clear to a green.
A change in colour or inflammation of the breast skin. Now it may look like orange peel because the pores stand out in the inflamed area. Some women find dimples, puckering or dents on their breasts. These can appear anywhere, even on the underside of your breast.
I took myself off to the doctor, faithfully, and he always did a breast examination. And he actually said to me, "Oh, I think you've got a little bit of a pucker there." I said, "Really?"
Show your doctor if you have any unusual pain that won't go away, or a change in your breast size or shape. Or if you find a lump or thickening of the skin on your breast, armpit, or even around your collarbone.
I preach to women all the time, check your breasts, know your body. But after that first bout of cancer, I got to the point where I just needed to have a break and to pretend that nothing could possibly go wrong with me again. And I was wrong. And it came back. And I could have spotted it earlier. Who knows? I mean, what if, but we'll never know. If I had paid attention just that little bit more, maybe I wouldn't be sitting here telling you that I have secondary breast cancer and it's going to kill me.
I wouldn't be here. I would not be here, and that's the truth of it all. Because it was so invasive, Yeah, I'm a very lucky girl.
Breast cancer can appear in many different ways, but in most cases there are actually no visible signs at all. That's why women need to start having regular mammograms from age 40. A mammogram can look for signs of breast cancer well before you can. So be breast aware. Know what's normal for you, and if you notice any unusual changes in your breasts, even if you've had a mammogram recently, show your doctor. Age is one of the biggest risk factors for breast cancer. So the New Zealand Breast Cancer Foundation recommends you start regular mammograms once you turn 40.
You just like to pop a gown on.
A regular screening mammogram is the best method we have to detect breast cancer early, because it looks for tiny tumours well before a lump can be felt. These wee granules of couscous are about the size of tumours that a mammogram can pick up, whereas this walnut here, that's about the size a lump actually has to grow until you can feel it yourself.
I didn't have any symptoms at all. So no, I didn't feel unwell at any stage. It was just a routine annual mammogram that picked up the cancer.
If a tumour is found by a screening mammogram, women have a 95% chance of living 5 years or longer. The survival rate for breast cancer is lower if the cancer is found by examination, simply because it's generally more advanced.
The specialist said that, yeah, it was really lucky that I'd done what I'd done from the age of 40, and that because it was caught so early that I'd been really careful, and there's probably no more risk, hopefully, for it to come back.
Here we go.
A mammogram is a safe, low-dose X-ray of the breast.
Okay, Eve, would you like to hold your breath again?
4 pictures are usually taken, 2 from the top and 2 from the side.
I've never found mammograms a particular problem. I know some women do. I know that some women find it quite painful. I mean, it's uncomfortable, but it's certainly not it's not a procedure which I find, put it this way, I've had so many of them, it's kind of like, it's a mammogram. Yeah, we'll do that. We get it. It takes very little time.
She's right, it's nothing to write home about, and nothing that should put you off.
Basically, we're comparing.
Once the X-rays are finished, your mammogram is closely checked by a radiologist who specialises in reading X-rays.
Hopefully, we'll see you again in 2 years' time.
Your results will then be sent to you, and with your approval, your doctor, within 2 weeks of your mammogram.
Not a big issue. It's good. I feel comfortable. For me, I feel it's so important because I want to grow old to see my children and get married and have children.
If something shows up on the mammogram that needs checking, you'll be asked to return for further assessment.
Okay, hold your breath, please.
Remember though, most women who are recalled will not have breast cancer. A mammogram is not going to stop you getting breast cancer, but what it does do is it cuts the risk of dying from it by around a third. The New Zealand Breast Cancer Foundation recommends that women have a mammogram every year from 40 to 49, and then every 2 years after turning 50. Between the ages of 40 to 44, you'll need to pay for an annual mammogram. However, if your doctor is concerned about your breast health, you may be referred for further assessment at no cost.
At the age of 40, I decided to have mammograms. And so I'm really glad that I didn't wait until I was 45, because it could have been a lot worse.
Once you turn 45, mammograms are provided free to well women with no symptoms until the age of 69. To check your eligibility to enrol, call 0800 270 200. Once you turn 70, keep having those mammograms if you're in good health, as your breast cancer risk is higher now than in your 50s.
Oh, where's your brother?
Younger women get breast cancer too.
I was 25. I had just been away on holiday with my now husband and found a lump. Is Georgia going to get your cars?
For women under 40, a mammogram is not usually recommended, as younger breasts tend to be denser. This can make it difficult to see small changes on a mammogram image. An ultrasound scan or MRI may be recommended instead to investigate breast changes. While the risk for younger women is lower, their breast cancer is sometimes more aggressive, so it's important to get unusual breast changes checked out.
I'm just going to lean you in.
Remember, early detection is your best defence against breast cancer. The earlier it's found, the easier it is to treat. So start having mammograms at 40. And if you develop any breast changes, show your doctor straight away. Don't wait until your next mammogram. It could be too late. Every woman is at risk of developing breast cancer, and this risk increases as we get older, especially over 50. 1 in 9 of us will develop breast cancer in our lifetime. And while uncommon, men can get breast cancer too.
When I was 27, I found what I thought was a lump in my breast.
I was 56 years old.
48.
43 years old.
The exact causes of breast cancer? Well, they're unknown. But what we do know is that there are certain risk factors that can increase your chances of developing the disease. You can influence some risk factors, while others you can't, like getting older, being a woman, and having a family history of breast cancer. Understanding these factors may help reduce your risk. The New Zealand Breast Cancer Foundation wants you to know that most women who get breast cancer don't have a family history with the disease.
There's absolutely no history of breast cancer in my family on either side. I'm the first. So that became a big shock. It was also a massive shock that I was just 31 years old when I was first diagnosed. Even then I thought, God, this is an older woman's disease.
The majority of breast cancer cases are in women over 50. However, if your mother, sister or daughter has had breast or ovarian cancer, and particularly if they were under 50, you may have a higher chance of getting breast cancer. And this one, that applies to the blokes too. It's important to know about the incidence of breast cancer on both sides of your family and discuss this with your doctor. Your breast health may need closer monitoring.
My mum was diagnosed when she was 48, and then my auntie was diagnosed under 50 as well. So I think it's about, as a family, being aware of it and onto it, and knowing that it's something that we do have to be careful of and look out for.
I'm just going to lean you in.
All breasts are different. Some women have a higher percentage of dense breast tissue, which may increase their breast cancer risk.
Okay, hold your breath, please.
When I first developed very dense breast tissue, I understood that the problem with that was that it would obscure any potential tumour. I now know from the research that I've read more recently that, in fact, that level of breast density was actually a risk factor in itself.
Breast density isn't something you can feel. It can only be seen on an X-ray. You may wish to ask about your breast density after your next mammogram. The good news? You can reduce your risk through lifestyle choices. Many studies show that women who are overweight, especially after menopause, have a higher chance of getting breast cancer. Maintaining a healthy weight along with regular exercise will help to reduce your risk. Research has shown that alcohol is linked to breast cancer, so try and cut back to no more than 1 standard drink a day. Exposure to hormones can also affect your breast cancer risk.
Many of us who are menopausal of age have terrible problems with hormones. And if the quality of your life is bad enough that you need to take hormone replacement therapy, then obviously you need it. We do know that after 3 years of hormone replacement therapy, your risk of breast cancer goes up. So definitely after 3 years, I advise my patients to start thinking about whether they still need it. And certainly after 5 years, the risk is really too great. And then once we've done one side, we merely go on to the other. The oral contraceptive pill at a young age is quite safe. In fact, it's protective for ovarian cancer, so it's a very safe thing to be on. But we do know that over the age of 40 on the oral contraceptive pill increases your risk of breast cancer as well.
So, know your risks and try to make lifestyle changes where you can. Maintain a healthy weight, build some regular exercise into your week, go easy on the alcohol, and talk to your doctor about the potential risks of the pill or HRT after 40. And make sure you share any family history of breast cancer with your doctor. And to further reduce your risk, start regular mammograms at 40. If you'd like more information about the topics covered today, you can visit the website. It's www.nzbcf.org.nz, or pick up the phone and talk to our breast cancer nurse on 0800 BC Nurse. The New Zealand Breast Cancer Foundation is a not-for-profit which supports New Zealanders with breast cancer, funds research and delivers life-saving education just like this. There's lots of ways you or your business can get involved. Please join us in the fight against breast cancer. Thanks for your time.